Hi everyone, happy Monday. It's Monday, June 8th. I'm Rendy Murphy, Epidemiologist and Director of Disease Surveillance at the Mobile County Health Department, here to give you our daily update on the effect of the COVID-19 pandemic on Mobile County. First, let me say that I hope everyone weathered the storm with safety and wellness, and that you don't have too much of a mess to clean up. We're not out of the woods yet. I believe we're still under a flood watch because there are lots of high waters in those low-lying areas. So please do not try to pass through a flooded area, even if you think you know the area very well. So we want to keep you out of the harm caused by high waters. So on the worldwide dashboard today, we're across the globe. There are more than 7 million cases of COVID-19 disease, with greater than 400,000 deaths, and a quarter of those deaths have occurred in U.S. residents. In Alabama today, the dashboard is reporting 20,590 COVID-19 cases, laboratory confirmed, with 335 probable cases. Again, probable is defined as having known exposure to a laboratory confirmed case, having symptoms of COVID, but not having a lab test yourself. Of those 20,000 or so, about 10% of those are hospitalized. 2,054. That 10% hospitalization rate is also what we see in Mobile County, and statewide 718 deaths in total, between the laboratory confirmed deaths and the deaths that were coded as probable on their death certificate but did not have a laboratory test. So just want to remind you, last week, it's been a little over a week ago, the statewide surveillance system in Alabama and many states began having some fractures because of the high number of laboratory results that are being sent to state health departments. So CDC and ADPH and the software vendor were all working to make improvements, and over the weekend several updates were pushed to those symptoms, and it does seem that things have improved. I just want to make sure that I help you feel confident that we've not lost any data on laboratory results. So all the lab results are still there. We're not missing any information. It's just that the ability for the investigators to go in and enter data after they conduct that in-person interview has been severely limited. So it will take probably a couple of days for the investigators to catch up with the delays that occurred last week, them not being able to access the system. So today, and we expect this to, as long as the system continues to do well today, we expect this catch-up will happen pretty quickly this week, so stay tuned for that. So in our daily report, we're providing information on 2,479 persons with COVID-19 disease. 2,462 of those are laboratory confirmed, and 17 are probable cases. So yesterday we added just 28 cases in Mobile. But again, we sometimes see a little bit of a lower number of cases reported during the beginning of the week, because Saturdays and Sundays are not high priority days for testing for patients or for some of these pop-up clinics. So of those 2,479, around 10%, 253, are known to be hospitalized at some course during their illness. I've not published this number because we don't have duration of hospitalization stay for everyone, but it looks to be around 8 or 9 days on average, ranging anywhere from just one night to many weeks. And 5% of our COVID cases have died with COVID. That's 124%. So again, in the last 14 days, yesterday we added 28 cases, on Saturday 56, on Friday 46, and then Tuesday, Wednesday, Thursday of last week was really affected by us not being able to get into the system, where we had pretty low numbers of reports earlier in the week. But I think the important thing to remember is that we're starting to look at demographics and case counts weekly, because there is so much variation that goes on during the day. And so last week, the week ending this past Saturday, 229 cases were added to the week, and that was compared to 230 the week before. So about the same number of cases reported weekly over the last 2 weeks. If you looked at our daily report, you will see we added some graphics on demographics. Yeah, I said that correctly. It didn't sound quite right to me. Just to help you visualize the distribution of age and sex and race a little bit better. If you're not a tables person like I am, you might be able to gain a little bit more information from these donut charts. So again, the largest majority of our cases are occurring in 25 to 49-year-olds, followed by 50 to 64-year-olds, and then by those 65 and older. We have just a small number, 2%, of children who are between 0 and 4 who've been diagnosed with COVID disease. For sex, slightly larger, larger proportion of female than male, about 58% female. And then again, African Americans are affected more than other races, 49%, but we have 25% white, 9 or 4.4% Asian, and I added the number of American Indian or Alaska Native to our report this week. There have been 7 American Indians diagnosed with COVID. That's at 0.3%. So I refreshed the calculation on presumed recovered the week ending this past Saturday. At this calculation, around 67% were presumed recovered. And if you have not memorized that definition, it's on the last page of our report, so you can take a look at it there. Still around 15% of our cases are healthcare workers, and around 23% are associated with long-term care facilities, 14% residents, and 7% employees. We're seeing that number go down just a little bit, which is good news. Now that testing is more widely available and test results are coming back in a timely manner, nursing homes and long-term care facilities and specialty care are able to more quickly identify COVID in their facilities, isolate residents and staff members appropriately, and try to control the spread in their facilities better than we were able to do 2.5 months ago. Our 7-day and 14-day moving average number of COVID patients has stayed fairly stable for the past couple of weeks. So that again is helpful news. Attributing that to the safer at home order and people hopefully staying at home if they're sick and not being around people. We won't see for another 7 days or so what the full effect of Memorial Day was. If you remember, the incubation period for COVID-19 is from 2 to 14 days. So we have to wait full 14 days past Memorial Day before we know for sure if there has been an increase in the transmission of COVID and the number of cases related to people apparently not adhering to the safer at home restrictions over the Memorial Day holiday. So on page 4, looking at the number of deaths and hospitalized, last week we added just 4 additional hospitalizations and 5 additional deaths last week. Again, the hospitalization is plotted by the day that they went into the hospital. So we count them during the week that they were admitted. And for those who have died, we count the date of death. So the week ending May 31st, 5 patients, Mobile County residents, died with COVID disease. The statistics around age, sex, race for those who've been hospitalized and died has not changed much. We're still seeing 90% of those hospitalized are over the age of 50 or older, and 80% are 65 and above. And we still have no hospitalizations or deaths in the 0 to 4 category. Only 1 hospitalization in the 5 to 24, no deaths in 5 to 24, and then we start to see a few as the age grows up that become hospitalized or have died. Among patients with known hospitalization, 36.6% required intensive care, and around 21% mechanical ventilation. Again, we talk about these because they are indicators for poor outcomes, and so we take a look at them. Of the patients who died the week ending Saturday, 86% of them died in a hospital, and 17 or just about 14% died in a long-term care facility. So we still, to our knowledge, have had no one die unattended that we know of, but we still have a couple of investigations that are ongoing there. And just a reminder that COVID transmission in long-term care facilities accounts for around 60% of all deaths in Mobile County residents, 74 of the 124 deaths that we're reporting. So again, we know that the outbreaks that are in those long-term care facilities contributed early on dramatically to our number of hospitalized and number died. And we hope that as we continue to do better with our, applying the information we have available to us now, the PPE we have available to us now, the testing and the laboratory tests that we have available to us now, we hope that those numbers will continue to stay low. You can take a look at the zip code map. We continue to work on zip code data that might be meaningful to you. Figure 6 on the last page of our report shows the information on laboratory tests, and I was disappointed to see that the number of lab tests really dropped quite a bit, nearly in half last week compared to the week before. So I really hope that this is not reflective of the apathy or the lack of concern in our community about COVID transmission. Anybody who wants a COVID test or who thinks they have COVID, thinks they aren't feeling well and it might be related to COVID, or if it's been 4 or 5 days since you were at your workplace and you think you may have been exposed, we can provide that test for you through one of our Mobile County Health Department testing facilities through our Family Health Primary Care Division. So please, continue to get testing. We have a goal of, the U.S. government has encouraged us and is funding us to try to build the capacity to test at least 2% of our population every month. And we had been exceeding that in Mobile County, but I fear that we may lose our ability to tell what's going on in the community if people are just unconcerned about the COVID outbreak and aren't going to get testing because of an apathy, or maybe they're consumed with other things. I know everybody's got a busy life, but of the 31,000 or so laboratory tests that reported on Mobile County residents early in the outbreak, so the worst week that we saw, that first week in April where testing really opened up, almost 23% of our lab tests were positive, and last week it was just under 10%. So last week it was 9.5% of all laboratory tests were PCR positive. So keep that in mind. So continue to get testing out there. So I hope you like the couple of things that we changed about the report. Again, if you have an indicator or something that you would like or would be very helpful to you, please comment on our Facebook page or let me know through our public information officer, and I will do my best. I do get a lot of questions about looking at the data with the cases that are associated with the outbreaks, taking that out. And as I mentioned last week, I do look at that, and we hope to maybe add some of that information pretty soon. All right, so some comments and some questions that we have on Monday. I just wanted to mention CDC has provided a toolkit to try to help the public understand better what contact tracing is and what it means and how important it is to the functions of public health. So I've talked a lot about the case investigation process and how we use that investigation as an opportunity to provide prevention measures to the person who is sick. And that's the same thing we do when we contact the contacts. So if you have been a member of a household, or if you've been around someone as defined by what we call the 615ers, so if you've been within 6 feet of a laboratory confirmed case for 15 minutes or more, then you are considered a close contact. And it's important that when we contact you, we need you to answer the call, right? Answer the call when Board of Health pops up on your caller ID, because we need to talk to you to help you, first of all, keep an eye on your own health so that you can stay safe. We want to answer your question, but we also need you to help us slow the spread of COVID-19. So please, if you get a call from the health department, please answer the call to slow the spread of COVID-19 disease by following the recommendations of public health. If you have been identified as a contact, that's contact tracing. And we know that sometimes we call at an inopportune time. We'll call you back. If you prefer to text, we'll do that too. We're not doing, we usually do contact tracing very much in person for things like tuberculosis or sexually transmitted infections. But in this situation, we're doing that by phone. So please answer the call to slow the spread of COVID-19 in our community. See, someone was asking about, this actually came from one of our contact tracers, one of our environmental health inspectors who's helping us with contact tracing. He had a case that he was investigating, and when he was following up with them, they had some questions about the fact that they were continuing to test positive even after they were no longer sick. And the patient thought that maybe she was getting reinfected because, now her husband's got, it's kind of like your family passing around the common cold in the wintertime because we don't build immunity to common cold. Well, the science is still out on whether or not you can get reinfected with COVID-19. So right now, we're not sure if that is occurring because, we've been talking about the fact that a positive antibody test or having antibodies to COVID-19 really isn't, we can't use that as an immunity passport because we don't know how long the antibodies that you developed are going to last, how strongly they can protect you from a second exposure to the virus. So we just don't have that information yet, and all of that is part of the scientific question about can someone get reinfected. So stay tuned on that as we wait on science from our federal and academic partners. We do know, however, that people will continue to test positive by PCR long after they are shedding live virus that could infect someone. So what's happening of a lot of these people, we've heard like as long as 40, 45 days, people are still testing positive, 3, 4, 5, 6 weeks after they were initially positive, and weeks and weeks after they've gotten well. And so a PCR positive test that long after infection usually is not live virus. It's just viral particles that are still in your mucous membranes and that the PCR is picking up. So if you had illness and it's been a couple of weeks after your first test and you're feeling better, but you continue to test positive, we know that that is true, but it's unlikely that that virus could infect anybody if it's been at least 10 days since your positive test or your resolution of symptoms. So stay tuned on the science related to that. I wanted to mention, we'll probably post this on our website. Just as I was walking into this meeting, CDC has published an article that there is currently no evidence that pets play a significant role in spreading COVID-19 to people. So I had commented before when someone asked a question, it looks like humans can transmit infection to pets. There have been a couple of cats that have become infected and have tested positive, but it's unlikely, there's no evidence that it goes the other way. So if you have an animal, particularly a cat, that has symptoms of respiratory disease, and you take them to your vet, and if they are tested and they test positive, please keep them away from your other animals so that they maybe couldn't transmit it to other cats or other companion animals. And very soon, CDC will be releasing guidance for public health veterinarians and private veterinarians on the handling of pets that may have COVID disease. Here's something from the Alabama Department of Public Health, effective June 15th. So this will be at the end of the week. The toll-free line that ADPH set up to answer COVID questions it's been going 24 hours a day, I think, and starting the 15th, it will go 7 days a week between 8 a.m. and 6 p.m. So they've not been getting a high burden of calls 24 hours a day, so they are going to modify that. Again, the number is 800-270-7268. You can call now, but on June 15th, the hours will change to 8 a.m. to 6 p.m. 7 days a week. And ADPH commented that if the need presents itself, hours can be readjusted quickly. So just a heads up about that. All right, here are some questions from the media. Someone asking me to talk about the delays and the impact on the numbers. So yes, last week there was a delay that the user interface, so the investigator interface of our surveillance, the statewide surveillance system, was experiencing difficulty, and which limited the amount of time that the investigators could get in the system. All of the laboratory results have come through. It's just that the investigators weren't able to create an investigation for those lab results. So some patches were installed over the weekend. It looks to be getting better, though I did see an email this morning that they had to reset the servers at noon today. So we'll keep an eye on it, but for now, it's working much better, and the labs have come in and are being assigned. Here's another question about the challenge of having funerals and weddings and other family events during the summer because of the COVID-19, and also, in context of mass protests. So yes, there is guidance, particularly for funerals, on the ADPH website, and I believe on ours as well. And through July 3rd, the state health officer amended Safer at Home order is still in place, requiring any gathering to maintain a 6-foot distance, and this includes funerals and weddings. Is it a struggle for health officials to convey the proper wearing of face coverings when there is mass gathering? And yes, it is. We have continued to say, there are things that happen when you're protesting that are conducive to transmission of COVID. Things like shouting and chanting and singing cause a greater expulsion of respiratory droplets than just having a casual conversation with someone. So it's even more important when you are shouting or chanting or singing that you wear a face covering. And also when you're out in a community protesting, it's difficult maybe to find hand washing stations where you can frequently wash your hands. You need to wear a face covering. As I said last week, use that as part of your message, right? Put your message on your mask, and that way when they show your face on TV, you'll be sharing your message as well. But carry things with you that will allow you to take some hand sanitizer or a bar of soap to wash your hands when you're out. If you need to, consider things instead of in-person protesting, like maybe car caravan protest where they are allowed, and those sorts of things, because yes, it is a struggle for us to continue to say wear a face covering when you see even law enforcement on the news that aren't wearing face coverings. So we continue to message that to both our public and our partners with us in city and county government. See, someone on Facebook said, I have a test today, and they use something like a cotton swab instead of the long nasopharyngeal swab. How effective is this kind of testing? So as effective. So it is a very effective test, which is why it was allowed to be used by FDA. It's not nearly as invasive too, and part of the advantage to it is that in many instances a person can swab their nose themselves under the guidance of a healthcare worker, and that way we protect the healthcare worker from potential exposure. So it's in many ways a much better assay. It's less invasive. It's less risky with regard to exposure for healthcare. So fewer personal protective measures are required for healthcare, that sort of thing. So you should get a valid test result with that. Please comment on collegiate congregate settings for fall. I've been talking to a few colleges, not advising them, but mostly listening to what they are saying, what they are thinking about doing as we move into the fall. Dorms are a point of high concern because of the congregate nature of those settings, and particularly ones that have common bathrooms and showers and that sort of thing. So I think you will see some wise decisions being made as our academic institutions decide how to reopen safely, and when they reopen, how to handle congregate settings like dorms, cafeterias, lunchrooms, dining halls, I guess is a better way to say that. Starting to show my age by calling it a cafeteria. So I think you'll see that those kinds of things will be considered. So I got another question here about someone who think they might have been exposed on the job, and shouldn't, what's the protocol? Isn't my boss supposed to tell me about this? And let me just share again. I talked about this on Friday, but I have a feeling that I didn't get the point across because of the way I framed the message. So let me just remind you of a couple of things. When we conduct an investigation, we interview people by phone to identify close contacts, and this includes co-workers, or if you live in an apartment complex, it would include people who live next to you, or maybe who were washing clothes in the laundromat at the same time as you. And then we call all of those contacts directly with instructions on testing and isolation according to CDC and ADPH guidance. So if you have not been contacted, it's likely that you are not considered exposed to COVID-19 as a close contact. And again, it's within 6 feet for 15 minutes or more, and that's a cumulative 15 minutes. So, and it starts the 2 days prior to symptom onset. So if I had my first symptom today, the investigators would ask me who I was around for 6 feet for 15 minutes or more for the 2 days prior to today. So they would ask me on Saturday, who was I around? On Sunday, who were you around? And they would walk through every day like that until they get to the day that the case is identified and begins isolation at home. Then we contact all of those contacts to let them know what they need to do, recommend that they get tested, but we need to tell them what interval they need to get tested. If I'm exposed to virus today, getting a test tomorrow is not helpful for me, because the virus has to, if you do get infected, it has to multiply in your body in order for it to be picked up by PCR. So it's tricky, and that's why our public health investigators who follow this guidance, and it changes all the time, and we have to update our message all the time. But please answer your phone when we call so that we can give you the most current, up-to-date, accurate information. So we don't divulge protected health information to employers, but employers may contact us if they have questions. If they, had an employee that was COVID positive and they want to get guidance, for example, on disinfection. And again, just sort of to re-message, anyone who feels that they need a COVID test is encouraged to call our appointment line 251-690-8889 to get an appointment at one of our 8 locations around the county at no cost to the patient. I believe we suspended testing today because of the storm, but again, you can call that appointment line today and get an appointment to be tested at any of our locations at no cost to you. So I'll end there for the day. Stay safe. Remember, be cautious about high waters, and we'll talk to you again tomorrow about the COVID outbreak in Mobile County.